Assalamualaikum doctors. In this video I am discussing how can we take UTI, urinary tract infection history. So the history task come like I'm telling four cases like number one is like 4 years old girl with recurrent urinary infections 4 times. Last one was 4 months ago for which she took the antibiotics in the hospital with only urine test done. With soreness from the back passage and constipation. She is not drinking enough water with false wiping technique from back to front and holding behavior. So this is the history comes with like some triggering risk factor, these are present. Another history come like 6 years old with background history of unilateral renal pelvic dilatation coming with recurrent UTI. So it is any renal tract abnormality present in the child. Another come like a 13-year-old girl who has yet again grown pseudomonas in her urine. Sincerely, yours Dr. Smith, GP, first UTI at age of 3, then recurrent UTI since then. Diagnosed with grade 4 vesico-ureteric reflux, VUR, has been on nitrofurantoin prophylaxis. So this is also again like any renal tract abnormality. And sometimes it comes recurrent UTI with abdomen constipations, then has antenatal abnormalities, family history of renal problems. So we understand that when we take the UTI history, so it is either triggering factor or either any antenatal problems. We ask that during pregnancy, what about the scan result, and about now any child has any chronic renal condition present or not. So how can we take the history? First, history of present illness, we analyzing the chief complaints. Does she get herself wet at night? Was she controlled before or not? When was the last time she wet herself? Nothing specific happened before this. Then about is there any holding maneuvers, like example standing on tiptoes, crossing of the legs, and or squatting with the heel pressed into the perineum and straining and weak stream. Is there any burning sensations, itching? Can she wait her turn to go to bathroom? How frequently she pees and how frequently she drinks? Describe for me her pee amount, color, odor. Is it frothy? Any abnormality in the opening of pee in boys? Wiping technique in females. Is it from front to back or back to front? Anyone measures her blood sugar? Anyone measures her blood pressure? Now about the general condition, we ask about the fever. Then about how much if the fever is low or high grade, we ask, and how can you measure, give any treatment for that or not, like weight changes, activity, sleep, we can ask. Other concerns like any dysmorphic features, chronic illness or long-term medical conditions, if known patients, take it details. Then we go the systemic review. For GIT, increased tummy size, tummy pain, site of pain, is it suprapubic or low end, character of pain, and radiations, any treatment given for that, heart poo, throwing up, yellow eye, mouth ulcers. Then CVS about number of the pillows that is used now sleeping before, how much pillow he used, any chest pain, exercise intolerance, awareness of heartbeat and blood pressure. CNS sign of increased ICT, headache, fainting, altered consciousness level, abnormal behavior, unusual movement, feet, hearing concern, unusual gait and facial asymmetry. Chest about the coughs and cold, recurrent bugs, rapid breathing, noisy breathing, and oxygen saturation. Emascule skin spots, deviation of the backbone, lumps, joint pain, swelling, changes in hair, nails, and hematology about the pallor, bleeding, bruising, recurrent recent any bug, endocrine heat intolerance, blood sugar measured. Then we are going to past history, we know as usual 5T IOA. So is that if it is recurrent, so when it first started, where, by whom was it diagnosed, how was he diagnosed, test done, if frequent, or urine analysis or culture done recently and its result, admissions, medications given by mouth or blood tube, or how long being admitted in normal ward or ICU, any medications on discharge. Then perinatal history, any abnormalities in the jelly scan during pregnancy, any comment on the amount of fluid around him, any abnormalities in baby's movement during pregnancy. So in pregnancy, the scan result we are asking, then puberty if relevance and health history, vaccination, missing any shots, extra shots, annual shots, any recent exposure to COVID, allergy, the nutrition about the type of food, number of meals, who prepared it for her, water amount, follow up with the dietitian or not. Then development plus go chart. family history of similar conditions or any chronic kidney disease, consanguinity, social about who take cares of her while the parents are at work. I'm sorry to ask you, do you suspect she exposed to abuse? Psychological, school, any issue, and bullying impact? How does the conditions affect the family? So mainly in UTI history, I'm highlighting for triggering factor. You ask what are the triggering, like any holding maneuver, tiptoe, crossing leg, something squatting, heel press the perineum, streaming. What about the straining, weak stream or not? Then is there any burning sensation? To search the UTI, burning sensation, itching, redness. Can she wait her turn when go to bathroom? Then how frequently she pee, how frequently she drinks. These are we ask. Then amount, color, odor, is it frothy, any abnormality in the opening of the pee invoice, wiping technique in females, then blood sugar, anyone measure the blood pressure, very important. About fever, details we are asking, constipation present or not, heart poo, very important. Any abnormal behavior, because child abuse sometimes cause UTI. Then deviation of the backbone, anatomical abnormality sometimes do that. And the past history, we know birth history, it is very important. Any abnormality in jealous scan during pregnancy, amount of fluid around him, because sometimes are antenatal cause. Then any recent exposure to COVID. Family history very important, and who take care of the child while the parents are at work. I'm sorry to ask you, do you suspect she exposed to abuse? Like stress factor, we are any bullying, new school change. How about the lighting technique from room to go toilet? Easy access to toilet or not? These are. So DD of UTI, what are we keep? First UTI, our diagnosis, either it is first attack or cystitis or pyelonephritis or recurrent or atypical. Then about enuresis, we can go abuse or an eye and psychological. So this is about how can we take the UTI history. Thank you.